Hello, everyone, and welcome. We're here to really sharpen your knowledge on antepartum care. This is such a crucial topic, not just for your exams, but for your entire career.
All right, so here's what we've got on tap. We're going to start with the fundamentals, the calculations and terms you need to know. Then we'll dive into clinical assessments and client education, and we'll wrap things up by putting your knowledge to the test with some NCLEX-style questions.
Okay, let's jump right into our first section. We're going to cover the essential math and the language of antepartum care that you'll be using literally every single day.
First things first, let's get our timeline straight. The word is gestation. This is the entire period of pregnancy, all the way from fertilization to the estimated delivery date, which is usually around 280 days.
So, one of the very first things you're going to calculate is the estimated due date, and for that we use Nagel's rule. This is a must-know. It's really just 4 simple steps. You start with the first day of the last menstrual period, you count back 3 months, you add 7 days, and then you just adjust the year if you need to.
And here it is, all wrapped up in a nice, neat formula. Just think, LMP minus 3 months plus 7 days plus 1 year equals that estimated due date. If you can lock this formula in your brain, it's going to make your life so much easier.
Next up, we have 2 terms you'll see constantly: gravidity and parity. Here's a super simple way to keep them straight. Gravidity is the total number of pregnancies a person has had, period. Doesn't matter what the outcome was. Parity, on the other hand, is the number of births that made it past 20 weeks.
And to get an even clearer picture, we use the GT-PAL system. This gives you that detailed pregnancy history in a single glance. You've got G for gravidity, T for term births, P for preterm, A for any abortions or miscarriages, and L for living children. It's basically the clinical shorthand that tells the whole story.
Okay, so we've got the lingo down. Now let's talk about what you'll actually see, how pregnancy physically shows up, and more importantly, how we categorize those signs.
Now this is huge. You've absolutely got to know how to classify the signs of pregnancy into 3 categories. First, you have your presumptive signs. These are subjective, things the client tells you, like I'm tired or I feel sick. Then you have probable signs. These are objective things you can observe, like a positive pregnancy test. And finally, you have the positive signs. These are the 100% diagnostic proof, like hearing a fetal heartbeat or seeing the fetus on an ultrasound. No question about it.
All right, let's get into one of the most incredible parts, all the physiological changes your client's body goes through. This is where your assessment skills are going to be so important.
Measuring fundal height is one of your go-to assessments for tracking how the baby's growing. Here's a great little rule of thumb to remember. Between weeks 18 and 30, the fundal height in centimeters should be pretty close to the week of gestation, give or take 2 centimeters. It's a fantastic quick check.
So what's happening on the inside? While the cardiovascular system goes into overdrive, a pregnant person's blood volume actually increases by a whopping 40 to 50%. That's to make sure there's enough to support both them and the growing fetus. It's pretty amazing.
And it's not just the heart and blood vessels working harder. The respiratory system is too. Oxygen intake goes up by about 15 to 20%. At the same time, as the uterus gets bigger, it starts pushing the diaphragm up. And this right here, this explains exactly why so many of your clients will tell you they feel short of breath, especially later in the pregnancy. You can see how that growing uterus literally pushes the diaphragm up, leaving a little less room for the lungs to expand. It's so important you can reassure them that this is a totally normal change.
Something else you'll definitely see are some skin changes. You might notice the linea nigra, which is that dark line that runs down the abdomen, or cloasma, which is sometimes called the mask of pregnancy. Again, your job is to reassure your client that this is just due to hormones and is completely normal.
All right, let's shift gears to client education, which is honestly one of the most important things you do. We're going to talk about some common discomforts and touch on the most critical nutrient for a healthy pregnancy.
When your clients are dealing with those common discomforts, your advice is everything. For morning sickness, little tips like eating a few dry crackers before even getting out of bed can be a game changer. And for those awful leg cramps, you can teach them to immediately stretch their calf by flexing their foot upward. That's dorsiflexion for instant relief.
Okay, if there's one thing you take away about prenatal nutrition, let it be this. Folic acid is absolutely non-negotiable. Its role in preventing really serious birth defects, like neural tube defects, is just so well established. This is vital information for any woman of childbearing age, even before she's thinking about getting pregnant.
All right, you've taken in a ton of information. Now it's time to see what you know with a few NCLEX-style questions. Take a deep breath. You've got this. Okay, first one up. A client's last menstrual period started on October 10th, 2025. Get out your mental calculator and use Nagalé's rule to figure out the EDD. Think back to that formula.
And the answer is July 17, 2026. How'd we get there? Let's break it down. You start with October 10th, go back 3 months, which lands you in July, add 7 days, which gets you to July 17th, and then, since you've crossed into the next year, you add 1 year. Bam! July 17, 2026.
All right, on to the next one. Picture this. You're with a client at 28 weeks gestation, and you measure their fundal height at 30 centimeters. How do you interpret that? What's your take on that finding?
If you picked number 3, you are spot on. It's normal for gestational age. And why? Well, remember that rule of thumb we talked about? At 28 weeks, the normal range is plus or minus 2 centimeters, so anywhere from 26 to 30 centimeters is what we expect. Our measurement is right at the top of that range, but still totally normal.
Okay, last one, and it's a select all that applies, so read carefully. Which of these signs are considered presumptive? Remember, we're looking for the subjective things the client would tell you, the things that aren't definitive proof.
The right answers are 2, 4, and 6. Amenorrhea, nausea, fatigue, these are all things the client reports, right? They're subjective. That's what makes them presumptive signs. The other options are either probable signs that an examiner would find or a positive, definite sign.
So as we wrap this up, I want to leave you with this thought. Knowing all these facts and figures is one thing. That's the science. But the real art of nursing is how you use that knowledge to connect with your patients. How are you going to use your communication skills to turn a simple clinical assessment into a moment of reassurance and education? That's what makes all the difference.